The American Cancer Society estimates that a woman's risk of developing ovarian cancer is 1 in 73. Unfortunately, if a woman is diagnosed in the later stages, the odds of surviving can be a little scary. But there is good news to report this morning regarding a new treatment. Dr. Ursula Matulonis joins us with more info. Good morning, doctor.
Good morning.
So this is interesting. You know, we're talking about ovarian cancer this morning, and my mom was actually diagnosed and thankfully had a successful outcome with ovarian cancer. But from what I understand, doctor, from my personal, family experience with it, signs and symptoms can be a little tricky because for most people, they just catch it too late.
Absolutely.
Right?
And of the 22,000 cases of ovarian cancer diagnosed per year, most of those women are diagnosed at late stage, so stage 3 or stage 4. It's very rare when we're able to pick up an early diagnosis, and that's really because we don't have a screening test to pick up early ovarian cancer, and also because of the trickiness of this cancer and its silent nature and how it kind of sneaks and gets to a later stage before a woman is even aware that the diagnosis has even occurred in her.
Man, it is scary. Do you think that it's ever going to change where we're going to be able to diagnose it or have an easier way to do that any earlier? Or is this what we're going to be facing for the next several years? I hope
so
not.
I think two important points. One is identification of individuals who are known to be at high risk of that cancer. So specifically the BRCA mutation. So if a woman has a very strong family history on either mom or dad's side, she should consider undergoing a blood test to see whether or not she carries this BRCA mutation. And then she can undergo risk-reducing surgery in order to prevent the cancer from happening. And the other is really a lot of research that's going around the United States and internationally about really trying to detect an early way of detecting this cancer. You know, the ways that we've looked at it have been through the CA-125 blood test, through the ultrasound, and unfortunately, none of those tests is successful at picking up ovarian cancer at an early stage. It picks up ovarian cancer. They pick up ovarian cancer, but they pick up ovarian cancer at a later stage. And that's not the purpose of a screening test. The purpose of a screening test is to pick it up early.
Yeah. Well, what do we do now? Because we are, unfortunately, a lot of people are being diagnosed with it later. What are the options if there are someone who's been diagnosed? Any good news there, to report this morning?
Oh, absolutely. So I think that it's important for women to be treated by a team who specializes in ovarian cancer treatment, so undergo surgery by a gynecologic oncology surgeon, somebody who's trained and understands the biology of ovarian cancer. Is treated by, again, a team who uses chemotherapy and understands the correct dosing and the way of giving it. And an important step that's just happened is the FDA approval of a drug called Lynparza. And this is 2014 marks the first year since 2006 that there's actually been a drug approved for ovarian cancer. And this drug, Lynparza, is our first step in personalizing therapy for women with recurrent ovarian cancer. So it's specifically for women who have recurrent ovarian cancer, have an underlying BRCA mutation, and have received 3 or more prior lines of chemotherapy. It's quite successful, and it's a really important next step for treatment of our patients.
Wow. All right. Well, if someone certainly, women watching this morning, what's the take home this morning? What do you want them to find out and know about ovarian cancer, and certainly, so they can have better options for people?
So information, education is vital. To learn more about Lynparza, it's lynparza.com. And patients can understand more about ovarian cancer through the American Cancer Society website, the National Cancer Institute website, and through our own website at Dana-Farber.
All right. Well, doctor, thank you so much. We certainly appreciate you taking some time to chat with us this morning.
Thank you so much.
We, of course, will put more info on our website, which, of course, is fox4morningblend.com.